So thank you for your attention once again. And without further ado, I will leave the floor to Professor Joannette. Thank you very much.
Thank you so much, Frédéric. It's a real pleasure to be here. Bon matin for those in Quebec, and guten Tag for those in Germany. It's a real pleasure. I see that Florence Gauzy, Peter Freyer, and other people I know very well are linked to this digital meeting, and the digital world certainly has taken a lot of place in our everyday life during this particular pandemic. The goal I have today will be to share the University of Montreal consortium in digital health, and I'm sure that by now you're seeing the slides. Yep, thanks Frédéric for the comment. Not that it's the only the digital health activity in Quebec, but I think it's an example of a University of Montreal led, but also involving other universities like McGill and the Polytechnique and HEC in this area. So very briefly, in the 10 minutes that I'm allowed, I will tell you or share with you what is going on a little bit as an example, and what's the signature, I think, of not only Université de Montréal, but of Quebec in terms of digital health currently. So just to remind you, this is a snapshot of Canada with the Pacific and Vancouver on the left, and the Newfoundland on the right, and Université de Montréal is one of the major driving force in research in this country. Please take note that if you add University of Montreal and McGill, you have something like the University of Toronto and maybe a little bit more. So that's what Montreal is in terms of academia in Canada. At the Université de Montréal, we have a number of groups which are really leading. IVADO is a science de la donnée, data science group, which is both Université de Montréal and McGill, and is a world leader in data sciences. Mila, of course, with Yoshua Bengio, created some years ago, is definitely a world-leading hub in artificial intelligence. And again, it brings together the strength of University of Montreal and McGill and other universities as well. And I just want to mention that Université de Montréal also has a very prestigious chair, what's called an excellence chair. The acronym is CERC in autonomous artificial intelligence. And this, again, is the recognition of the excellence of what's going on in Quebec and in Montreal. Irina Rich is the holder of this chair. So our scope goes from data science and artificial intelligence to electronic medical record, telehealth, health application, mobile health. So all this is digital health, not only artificial intelligence, but also the applications and the use. And we know how mHealth is, in fact, important not only for curing and monitoring and diagnosing, but also in terms of prevention of health conditions, not only physical but also mental. And we know how artificial intelligence is now included and embedded in many of those mHealth solutions. Our objective at the Digital Health Consortium, or Consortium Santé Numérique in French, is to coordinate and develop a research and teaching in digital health. Teaching and training is not a trivial object here, because we have discussed this with our friends and colleagues in Bavaria, how to prepare the professionals of tomorrow, how to update the professionals of today. There is a huge challenge here. It's also to deploy a strategic vision and a responsible approach to digital health for the entire network within the university and across universities. It's also to attract and support the recruitment of what we call double competency researchers, or bilingual, those who are able to speak health, but also digital. And these are not necessarily very frequent, not because they're not a lot trained, but also because they're quite in demand by industry, but by by universities. But these people in double competency are central as an anchoring point in order to develop such approaches in the network and in relation with partners and industrial partners. It's also to support and enhance synergies between all the members, and I'll have a list of the members, but the creation of data lake between many of our university teaching hospital is one of the things we support. We have a support team made of highly qualified personnel in data science that are actually presently devoting themselves to this role, and to support national and international global collaboration. Our values, and this is the signature, I think, of Quebec and of the Université de Montréal, is first of all a responsible approach to the digital transformation in health, and the Montreal Declaration on Responsible AI, which you can find on the web in many languages, in at least a couple of languages, is an example of this. And the other value is that we strongly believe in a One Health approach. And I took here something from the One Health European Joint Program graphics just because I found it nice. But the One Health approach where animal, human, and environment health is taken all together is very important. And we have, for instance, at the veterinary faculty of Université de Montréal, which is one of the only in Quebec, a very big project in AI and agro-health approaches. Now, just the German translation of this Montreal Declaration is coming soon, and so we're very happy that this will be available very soon with the collaboration of Florence Gauzy and all the people in our colleagues in Bavaria. You have here a list, and sorry for the acronyms, but each country, each culture has its own acronyms, and I'm lost in others. But you see here that the Digital Health Consortium is not only about medicine and veterinary medicine and optometry and pharmacy, it's also about environmental design. It's about law, the cyber security and the legislative context is important. It's about music, which uses M-Health approaches to support the wellness of people. And so it's all these aspects. In terms of hospitals, we have the main University of Montreal hospital, which is a unique hospital here in Montreal, very recently built, and also the Children's Hospital, which is called Sainte-Justine, and that's why the acronym. And then we have a series of those things that you see here, which are called CEUSSS, which are integrated multi-establishment local hospitals, but also with long-term care facilities, rehab centers, and so on and so on. The Heart Institute in Montreal is also very important, and we have other members as well, including the business school and with the business university here, HEC Montréal, and the Engineer University, Polytechnique Montréal, of course, with Mila Ivado that I mentioned. And we're very happy and proud to be part of ECH Alliance and also Digital Health Canada. So in terms of examples, and these slides will be made available, as I told you, we deployed a digital health advisory support team, in order to support the sharing of data and the creation of data lake. And I know that in Munich there is a similar project, so we're working together, and we hope to work together more. We also propose an integrated training framework in digital health, and this also is a joint question that we will want to pursue together further. We also have recently produced a two-pager on the state, summarizing the principles in order to facilitate access to government big data, both in administration and health data, in order to support research and AI research for better healthcare services and decision. And as you know, Quebec, like Germany, is a universal public health system. So there is a big potential, but there are barriers currently to the access to these data, which makes the life of those using big data much more difficult. And of course, we have scientific activities such as symposium and seminars. And just before this bizarre period that we're living now, we did organize a responsible innovation in digital health symposium in Montreal in January, where we had the WHO people, local people, and panels. And this is, of course, something that we want to come back to, not only in terms of event, but also in terms of exchange. And I will finish my 10 minutes just mentioning that we're very happy to be supported by the international collaboration and Francophone Minister of Quebec with the equivalent of Bavaria into some bilateral cooperation programs on 4 topics, and this is written too small, but it will be useful in the slides when you will get it. But it's all about, it's 4 projects, it's 4 areas that I mentioned: data, property and access, training, techno-social innovation, because the innovation is not only technical, it's also social, and it has to be integrated if we want to approach this in a responsible manner, and this data lake configuration between major university teaching hospital. So, danke. This is the Digital Health Consortium, and I'll be happy to first share the slides, Frédéric, with all the participants, but also to answer any questions. Thank you.
Merci beaucoup, Professor Joannette. That was very interesting. Of course, I didn't expect anything else. I see there's already one question, which we will keep for the end of the presentations. Just a small clarification: we do have a little bit more time for the presenters if they need it. So it's 10 to 15 minutes. Just as a little heads up, but otherwise I would suggest now that I hand over to Justine Caillot from MedTech Plus. Justine, the floor is yours.
Thank you, Frédéric. I will just share my screen with you. So can you hear me well? And could you see my screen?
Yes.
Yes to both.
Perfect. Thank you. So hello, everyone. I'm Justine from MedTech. I'm very pleased to be with you today. I'm going to present you MedTech, what we are doing at MedTech, our mission and objective we give ourselves to support the medical ecosystem. Please let me know if you have any question. I will be happy to answer them at the end of the presentation. So MedTech is a Quebec consortium for research and innovation in medical technologies. So our mission is, through collaborative projects led by industries in collaboration with academic partners, to accelerate innovation and position on a global scale products and services developed by Canadian and Quebec companies, thereby generating major impacts, so economical impacts, but also impacts for the benefit of patients and impact on the healthcare system. So MedTech Consortium was launched in 2013 and supported firstly by the Ministry of Economy and Innovation in Quebec. Other consortium have been created in priority areas in Quebec, such as aeronautics and advanced materials. So MedTech plays a major role in the medical ecosystem by bringing together the complementarity skills of industrials, of public institutions, hospitals, and university, by accelerating the integration of new technologies, innovative and disruptive solutions, and developing cutting-edge knowledge and expertise. As I said, firstly, so we were supported by the Ministry of Quebec, but we are also partnering with strategic partners across Canada, so with strategic organizations, so public organization to get funds for collaborative projects, strategic research institute, And so diversified partners, each bringing its expertise for the benefit of our teams. I will present you shortly our network. So as you can see on the chart, since the creation of MedTech, our network is growing rapidly. We've got more than 190 members with complementarity skills. As you can see on this chart, so the distribution of a member, so more than the half of our members are represented by startup and SMEs, then large company and university. So on this slide, just another view with some logo. So some companies you already knew as Siemens Healthineers or Medtronic that are member to MedTech Consortium. We are also partnering with the Health Network and also collaborating with international organizations in the US, in China, and also in France to strengthen the proposal of our teams and members. So why are we supporting collaborative projects? So first of all, it's to create synergies between industry, distributors, university, to reduce the risk for each party, so technological risk, but also for the commercialization risk. And because thanks to the grants program we have at MedTech, we are able to fund collaborative projects. So usually a collaborative project comes from a business idea and then the project is carried out in a public institution such as university or hospital, and when needed, we could help through a network to find a strategic partner to strengthen the project. So I will shortly present you a different tool we offer to our member that allow us to support innovative projects from prototype design to commercialization. So we've got two grant programs, the two blue one, the Impact one and the FSI SSS one. We offer also dilutive financing for companies from the validation stage of the technology. So it's called the Invest program. We are also able to provide offering to companies which accelerate commercial success through a personalized coaching. It's called the Acceleration Innovation. And finally, through the bietet program, we contribute to the integration of innovative and disruptive technologies into a network of excellence. So I will go in more detail in each program. So the first one, it was the first program led by MedTech. It's a grant program supported by the Ministry of Economy and Innovation. So it's a program to support projects led by at least one academic and one industrial partners. We are able at MedTech to fund up to 1.5 million per 3-year project. So over the last years, we supported 80 projects for a value of more than $60 million. And last year, more than 90% of the approved projects by MedTech were in the digital health area. We also have another grant program. It's called the FSI SSS, and this program it's to provide finance support for projects designed to the validation in a real care environment. So for this program, we've got two segments. On one side, we are able to support Québec SMEs, and on the other side, we are able to support organizational innovation. So we supported 55 projects for a value of $18 million, and the support for each project it's up to $240,000 per project. And this program is in collaboration with the Ministry of Health in Quebec. On the other side, so not on the grant program, but more on the coaching one, we've got experts on our team that are doing really good coaching to our members. It's a free coaching dedicated to Canadian companies, startup and SMEs in health tech. The goal is really to identify new opportunity business to simulate innovation of products and services, and to accelerate and facilitate collaboration between SMEs, users, large group, and healthcare partners. This program was launched last year, and we coach 14 companies. So firstly, I said that we were supported by the Ministry of Economy and Innovation of Quebec. It's still true, but we are also supported since 2017 by the Canada government through the Support Center of Excellence for the Commercialization of Research. And with the fund, the goal is to support the integration of expertise in Canada. With this fund, we created two tools. So one is to invest into companies, Canadian companies, so we are able to provide direct financing to innovative startups and SMEs. And the other one is called the bietet program. It's more like a network of excellence and the creation of a fast track to adoption in clinical sites in Quebec, in Canada, but also abroad. So here you can see the invest program, so the deal we closed. So we've got fund of 40 million investments. So we invest in exceptional Canadian teams committed to developing and scaling health tech technologies solution, benefiting Canadian patients and citizens. So at MedTech, we leverage a strong consortium of hospitals, service providers, and multinationals to ensure that growing companies not only have the capital, but also have the clinical or market expertise needed to drive adoption. In this program, we work hand in hand with other co-investors in the health technology space to provide fuel for pre-seed, seed, or Series A company with investment up to 1 million per company. So as you can see on the map, first of all, the well-known ecosystem were in Quebec because MedTech is based in Montreal. So we closed 8 deals in Quebec, but now we are expanding our expertise and our investments across Canada in other provinces. So just a slide to present you the companies in which we invest. So it's even a medical device company and also AI-driven company in the health space. Finally, I will present you our bietet network and bietet program. So from the outside, on both industrial and public sides, we identified needs and challenges for the adoption and integration of innovative solutions. So the goal of the bietet program is to bring together the industry, the KOL, the clinical expertise, but also the procurement and IT services of an hospital together to work together on a fast track to adoption for the benefit of patients and for the benefit of the healthcare system. So it's really a unique partnership between Center of Excellence and company. The goal is to have access to KOL, to platform, to data lake. It's even more true when we are talking about project in AI. It's always fast-tracked in a controlled process in a real care environment to accelerate technology adoption. So for this program, we identified 4 areas in which Canada is already good: AI VR simulation, AI health deep learning, imaging, neuroinformatics, rehab, and autonomy. So really the goal is to bring projects in this area, in this expertise, and to work all together to adopt the innovation and the solution into the field. So the benefits and the goals are different if you're on the side of an SME or on the side of a Center of Excellence. So for the SMEs, the bietet program, it's really a process to de-risk the innovation path through a controlled process in a real care environment. It's also to confirm a product market fit, and it's able to have the access for the collection of evidence data. And for the Center of Excellence, it's a privilege access to the best medical technologies based on their measurement value. And it's also a reinforcement of the reputation of the center in the innovation. So just now a slide of our network. So the center, which are part of the Beachhead network. So as you can see, there are some hospitals in Montreal, in Quebec City, but also hospital in Ottawa, Alberta, and also abroad. So not only across Canada, but we are also partnering with some institute in Strasbourg and with the Sheba Medical Center in Israel. Finally, I will present you some success stories on our side. So we've got the company Imager, for example. It's a company AI-based diagnostic for oncology, and we are supporting them with 5 collaborative projects. Another company, it's Alaya Care, so it's a Montreal company developing home care optimization with AI system. They have 3 collaborative projects with us. And finally, the company Dialogue. So I will leave then Jean-Christophe talk to you about that company. And we are also working with them with 2 collaborative projects. Thank you for your attention, and I will be very happy to answer your question.
Thank you very much, Justine. Very informative again as well. I have a few questions which I'm going to keep for the discussion round, but thank you for also respecting your time limit perfectly. This allows me to go right to our last speaker, Jean-Christophe Delerue from Dialogue Technologies. Jean-Christophe, the floor is yours.
Hello, everyone. Thanks. I think I have some issue with sharing my screen. My laptop is basically blocking it. I'm used to Zoom, so maybe Frederic, I can share send you the presentation, or you can share it with from your laptop if you have it.
Yes, I have it. I'm gonna try to share it right now. Just one sec.
Thanks. Sorry for that.
No problem. Okay, is this working?
Amazing. Thank you so much.
Okay.
My name is Jean-Christophe Delerue, or JC in English. I'm in charge of PR and GR for Dialogue. Next slide, please. Dialogue was founded in Montreal in 2016, and I'll share a bit some data point about the company in a few seconds. But I wanted to share our mission, which is to improve the well-being by using technology to deliver care. Next slide, please. Dialogue, funded in Montreal by three of our co-founders, including our CEO, Sharif Habib. We raised over 100 million from leading Canadian, but also international investor. We now have over 850 employees in Montreal, Toronto, Calgary, but also Munich. We serve over 25,000 organizations across Canada. Organization being like employers, insurance company, but also like student association and so on. Through these 25,000 organizations, now millions of employees and their family members have access to Dialogue, which means that every day now we facilitate over 1,300 consultation, which is basically more than the largest ER in Canada. We are Canada-wide now, bilingual 24/7. And maybe one thing of interest to note is that the only way for dialogue to be accessed by a patient is if the employers or the insurance company or the organization offer access to dialogue. So dialogue remain free for the patient. The cost is always covered by the employer or the insurance company. And we'll see it through in the next few seconds. But like our vision is to have really to provide access to a multidisciplinary team of healthcare professionals to facilitate prescription, specialist referral, and navigation through public healthcare system. All of this in minutes. Next slide, please. This is just a quick slide to demonstrate the growth of dialogue since foundation and over the last few months. We'll discuss this a bit further, but one thing with COVID-19 is that it really accelerated the adoption of telemedicine, giving its facilitating access to care through social distancing measure. Next slide, please. This is the patient experience when someone connects to dialogue. So it starts with an AI triage. The goal of the triage is to redirect the patient to the right healthcare professional as fast as possible to maximize the time between the patient and the healthcare professional. So once the AI triage is done, then there's a consultation, which is through video conferencing. There's a care plan that's provided to the patient. When required, there's a prescription. For the prescription, it's either delivered directly to the home or the office of the patient or to the pharmacy of choice of the patient. In the cases where a physical consultation or a consultation with a specialist is required for the patient, we offered navigation. So basically what it means is that, for example, if a patient needs to be seen in person with a specialist, Dialogue will make the appointment for the patient in the public healthcare system. Some data about this, it's about less than 30% of patient encounters on Dialogue needs a referral. And what's unique to Dialogue is that we ensure follow-up. So every patient, after a few days, will receive a communication from Dialogue where a healthcare professional will want to know if there's an improvement to the medical condition that the patient had. Next slide, please. These are the three pillars on why Dialogue is different. So we are focused on experience, utilization, and safety and security. So as I mentioned, on the experience, we use AI triage, and this is to improve the time and the quality of time between the patient and the medical professional, and ensure that the patient sees the right medical professional as soon as possible. We offered, as I mentioned, navigation through the public healthcare system. We ensure follow-ups after each consultation, and most importantly, we are based on the continuity of care. For example, a patient will always have the option to see the same professional he has seen before if he has a second consultation. On utilization, Dialogue, as I mentioned, is B2B, business to business only, meaning that the only way for a patient or to have access to Dialogue is through its employer or insurance company. But we want this benefit to be used by Canadians. So we have teams that are dedicated only at ensuring that employees, but also family members of the employees know of Dialogue, know how they can use it, and actually use it. So that's why we do proactive engagement. And for example, we have account manager for each company to ensure that the employees use Dialogue and the benefit of Dialogue. When it comes to safety, given we are obviously in the medical domain, it's a top priority. So we have for example, SOC 2 Type 2 certified, CE marked. We have a medical board that review the best practices periodically to ensure that we are always not only compliant, but above and beyond when it comes to medical practice. And we also have Chief Privacy and Medical Officer. Next slide, please. This is the vision for Dialogue long term. Right now, we offer primary care, mental health and well-being, and employee assistance program for our clients. The long-term vision is to start offering OHS, which is occupational health and safety, go on women's and family health, sleep and insomnia, and much more as technology evolve as well. The long-term vision is that patient no longer Google it, but dialogue it. Next slide. And I think this is the end, and I would be happy to take any question you may have about Dialogue and our service.
Very good. Thank you. Thank you very much. I like the last line. You dialogue it and you don't Google it. That's I'll remember that one. Very good. Okay, so this concludes the series of our presentations. I hope that this has generated some interest, some questions. I see two already, so I'll get right to it. I believe the first question is for Professor Joannette with a question about your consortium and if Health Canada is also part of it or involved in order to drive digital health in Canada.
So the answer is no. Health Canada is not part of the consortium, but we're working with a lot of partners in Quebec and in Canada. So the consortium, just to remind everyone, is essentially starting from the University of Montreal with other universities and maybe evolving towards a more pan-Quebec consortium at one point, if there is appetite from all the partners. At the level of the Canadian government, as you know, Canada has a number of provinces and territories, 13, and health is a jurisdiction of those provinces and territories. And at the level of Canada, there is indeed Health Canada. There is also the Public Health Agency of Canada, but there is also, in terms of research, the Canadian Institute of Health Research. It so happens that during the last 8 years, up until a year ago, I was having digital health at the Canadian Institute of Health Research and working with the Public Health Agency of Canada and Health Canada as well. But, and so I think you have to just consider that we're working together in some kind of network. And one of the example of this is the IDIH, International Collaboration Digital Transformation, in one area in healthy aging, in which Germany is part, but also Canada is part, and we're playing also a role in this environment, which is a little bit more focused on the healthy aging aspect, but there's so much to be done there in terms of digital health and the use of AI, not only for treatment, not only for the diagnosis of, let's say, neurodegenerative diseases such as Alzheimer's, as we saw in the MedTech presentation, but also in terms of support to the people living with some level of chronic diseases at home and needs to be supported. And again, digital health here is really helping them. So the blunt answer is no, but we're all linked together. Thanks, Frédéric.
Okay, very good. The second question I received, I believe, is for Dialogue. The question, I don't know if you can see them as well, Jean-Christophe, or not, but I'll read it. So does Dialogue also handle potential side effect messages? And if yes, what's happening with this information? Who's the receiver of them? Do you have an answer to this?
Could you just clarify what side effect? Just to make sure I understand the question.
Okay, I'm going to let maybe Mr. Schmidt try to type the answer, but the way that I interpret it is if you do prescribe some medication and there are side effects that present themselves, I'm assuming maybe how do you handle that situation? That's how I interpret the question.
That would be a great question for a medical board or director, but like I would just reiterate that, dialogue after each consultation, especially a consultation where there's a prescription because there's a medical condition, there will be a follow-up in the next few hours or day, depending on the medical situation, and that's how I think this would be handled. We don't see it like there's some service where you basically pay for a consultation, you get your prescription, and that's it. At Dialogue, it's a clinic. Yes, a virtual clinic, but it's a clinic. So our patient will follow up with him and until there's a remission. So that would be the answer to the question, I think.
Okay, thank you very much. I believe that Martin Schmidt just wrote, and I believe that makes the question clear, and the answer as well is precise with respect to it. I move on to the next one, which is for Jean-Christophe again. What activities does Dialogue have or is involved in Munich?
So in Munich and Berlin, we beginning of the year we acquired the German company called Argument. So it's a company dedicated to OHS, so occupational health and safety, which is a huge market in Europe, but especially in Germany, given the legal requirement for each company to have certain standards when it comes to the safety and the health of organizations. So we acquired Argument. We are building Argument, leveraging our technology that we built and developed in Canada, and that's for now the operation that we have in Germany, and there might be more to the next few months. So stay tuned.
Very good. Thank you very much. I have a question here again for Professor Joannette. How can big data in digital health be used in R&D collaboration with clinics and or insurers, protecting at the same time privacy, data, and protection? This is a very complex question, so let's I will leave it to the experts.
Thanks, Frédéric, for the question, because it's a big one, and one that we should probably try to reflect and work more between Bavaria and have different environment, complementary environment, and that's a big question to debate. And thanks to Peter Freyer for the question. Peter, I prefer being in the same room or eating the same meal, or at least at the same table. But the sharing a screen is what we can do currently, so that's good. Thanks to digital. So the protection of privacy and the data has to be a main driver of any policy in order to access these big public data. And we're very sensitive here in Quebec, like in many countries, but I would say we're probably a little bit one step further sensitive in terms of the protection of data, up to the point where we should not be only protecting, of course, because if we only protect, then we won't be able to do anything with those data. And we will not be able to enhance the public health and the health of the population. So there's a balance here. And a balance means that it's not necessarily eliminating any risk, but it's controlling risk. And it's risk control. Now, risk control has to be very tight, of course. And so we have expertise in Quebec, for instance, researchers with private partners, because private partners and researchers can have access to those data if the finality of the access is in the interest of the public. There's a long history of access to those data without any breach in confidentiality up until this point in time. Now we're living in a world where cybersecurity is more and more has to be more and more tightened, just because those who would like to breach now have access to the same powerful tools of AI and digital tools that we have to analyze this. So the enhancement of the threat is there, but we have to be very, very, very careful. So it's doable. It's not without any risk. It's not a zero risk, but it has to be very, 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 very low. And we are working here in Quebec to better to try to identify a better balance between the risk and the benefits, because the benefits are so big. And I want to thank all the governmental agencies that are working in this direction. And I know the current Quebec government has this openness and openness to this risk management.
Thank you very much for that answer. I'm sure you could talk about it even longer, but we are on a tight schedule. I'd like to throw in one of my questions at this point, and this one would be for you, Justine. You mentioned in your presentation that there are some international collaborations already ongoing at MedTech Plus with France and China and Israel, amongst others. I'm assuming that means that there is a possibility for MedTech Plus to be involved in potential projects with Bavarian research institutions or Bavarian companies as well.
Yes, definitely. We are definitely looking for partnering with some institution in Bavaria, and we are already talking with Medical Valley on this side. So a consortium like a bit like MedTech with more an incubator side. So we are really looking to have partnership with you.
Excellent. Very glad to hear it. And I'll address the same thing to Professor Joannette, but with a slightly different twist. You have 4 projects, I believe, ongoing with Bavarian partners already. Are these projects closed in the sense that there's no more possibility for other partners to join in, or is there certain projects where expertise would still be welcome?
No, absolutely. The projects are not only not closed, but they're starting. So it's a good time to manifest yourself if you're interested in one of the 4 topics that I mentioned. And I understand the slides will be distributed so you can read about it. But these projects are there as not as a closed team between Quebec and Bavaria, but as a vector of communication and inclusiveness. So there's I'm sure that Florence Gauzy from the Bavarian side will be supporting what I'm saying here, and anyone who would like to be involved in one of those projects on the creation of data lake, on the training, on the techno-social innovation in digital health, and the 4th one is absolutely welcome.
Okay, excellent. Glad to hear it. I see this has generated a few more questions, and so we still have some time. I'll go ahead and read them. Laura Schreiber writes, are there research groups and potential funding opportunities interested in disease outcome prediction based on imaging, such as cardiac MRI? I'm assuming that this question would probably be either Yves or Justine. Yves, I'll let you take it.
Well, from an academic point of view, and I'll leave Justine talk about the industry aspect, you have to keep in mind that Canada is probably one of the most non-European country, and is part of many of those joint programming initiatives that are present in Europe in order to favor inter-country collaboration. And Canadian collaborators can be included because there is support for the Canadian partners in there, both from the Quebec agencies in some cases like ERA Neuron, but also from the Canadian agencies such as the Canadian Institute of Health Research in joint programming such as AAL, Active Assisted Living, and the one on the joint programming on neurodegenerative diseases. And I see you're looking at cardiac MRI, but keep in mind that the heart and the brain are closely linked together, and there's frequently projects involving both, and other programs as well. So I think you have to think not only of Bavaria Quebec program, but to use fully all the larger programs in which the Bavaria Quebec collaborations can be expressed.
Thank you, Yves. Justine, would you like to add something?
Yes, definitely. So on the academic side, I'm sure there is a high interest, and I benefit for this kind of project. So on the scope of the project, collaborative project, we support at MedTech. We only supported project with industrial partners. And in the imaging side, there's a lot of companies in Canada specialized in cardiac MRI, for example. So for sure, we've got some project on this side and more to come.
Okay, and maybe I'll add a little note to the with respect to funding opportunities. In general, in between Bavaria and Quebec, there's always a principle of reciprocity. So that means the Quebec side funds Quebec partners, and the Bavarian side would fund Bavarian partners. So if there's some interest, if we can find some companies or research institutions in Canada who would like to work, for example, on cardiac MRI projects, Ms. Schreiber, I would say the best way for you would be to look at your opportunities through, for example, Medical Valley or the Bavarian Ministry of Economic Affairs, who their technology department funds certain projects as well. Here is another question from Zilke Ditkin. Is MedTech Plus only interested in partners in Bavaria or also in the rest of Germany?
So for sure, Germany is really interesting for us, especially in the digital health technologies. So if there an interest from other center of excellence, if there is expertise, if you can have access to data lake, and that could benefit companies and the patients. So of course, we will want to have a look on that.
Okay, very good. Excellent. So I think that...
Can I just
yes,
offer a complement here of information to what Justine was saying? One of the Quebec Bavaria project is about having a compatible, coherent approach to the data lake between university teaching hospitals, some of them in Montreal, and between, for instance, the LMU and TUM in Munich. And so this will create, I think, a more powerful way in order to support what Justine was saying, because these two lakes, so to say, will be connected by at least a river, let's say, between these two lakes, in order to facilitate maybe the power and the availability of data at one point. This is work in progress, but I think it's going in the right direction.
Excellent. Very good. Well, I'm very pleased with our discipline of time management. I don't see any more questions. I think we had an excellent discussion as well. I'd like to thank all the speakers for your time. Happy everything worked without any technological hitches. My last words address the Bavarian participants. Feel free to contact me if you have other interests or questions with respect to Quebec or Canada and digital health. It'll be my pleasure to try to help you find the answers and potentially the partners. I believe there's a lot of potential and interest to work in between Bavaria and Quebec. So in that sense, feel free to reach out to me. And again, everyone, thank you for your contributions. And on this, I'd like to wish you all a good rest of the afternoon or a good rest of the morning for the speakers in Montreal.
Thanks to our chair.
Thank you.
Dankeschön.